Galit, I know you're very humble and you just love talking all about yourself, but how did you get into this field? How did you come to work at Lone Pine?
So I've been a vet for a bit over 25 years. What I did was I did a science degree first at university because we don't do college here. We just go straight from high school to university. So I did a science degree in parasitology. And then when I finished that, I started doing vet. But while I was studying vet science, which is 5 years here, I started working here on the weekends. So I worked as a koala keeper initially, and then I worked with the reptiles. And then I ended up working with everything as a keeper. And I found that that was a really good basis for understanding a lot more about husbandry and what normal was. Because I think with veterinary science and working with exotic animals, you really need a good understanding of what normal is to really understand what abnormal is. So, you might see a koala pacing on the ground and think, oh my God, what's wrong with this animal? And then, if you know something about koalas, then you can ask the appropriate questions. Is that animal in season? Is it breeding season? And that animal's at, an age where they might disperse in the wild. There's a lot of those kind of behaviors that you kind of need to understand based on the age of the animal and what its behavior is before you can really understand, okay, that animal is unwell and we need to intervene in some way. So for anyone wanting to work with wildlife or in zoos, I really would encourage you to do whatever volunteer work or even just working in a zoo as a keeper as well, because you'll gain a lot of basic knowledge that you won't have.
So you've got someone coming down behind you.
If you come into something
on the move.
That's Fletcher.
Oh, hey, Fletch. Oh, yeah.
Fletcher's leaving. Doesn't want the attention. So I worked as a keeper all the way through vet on the weekends. And so when I graduated, I left and I worked as a keeper here, funnily enough. So I went to work in private practice with small animals, dogs and cats, for 2 years. And I've actually had quite a lot of clients come to me with reptiles and injured wildlife because they knew I had an interest, because I had my own reptiles at home as well. And so then the job became available here at Lone Pine, and they actually contacted me because they knew from working here to ask me if I was interested in the position. So you can see that there's a lot of benefits to
getting a foot in the door,
getting known, meeting people, just interacting with people in the industry if that's something that you're interested in. So yeah, I've been here for 25 years as the only vet. I'm on call 24/7, so I'm very tired. I shouldn't say that because I don't often get called at night. I do get calls. So it's, as Kayla's probably told you, it's all Australian natives here, but we do have farm animals as well. So I had to step out of my comfort zone at the beginning and remember what to do with a sick sheep. But it's actually been quite nice working with the farm animals as well, and the sheepdogs, and just getting that side of it. Wildlife can be quite challenging. I'm sure some of you understand that they do things very dramatically. They hide everything when they're unwell until they're really unwell, and then crash in a heap, and then it's very difficult to get them back again. So you really depend on the keepers that look after them for information and to really know their animals well. And having a good relationship with keepers and good communication is really important, even if they're just telling you stuff that you think, yeah, that's not an issue, but just taking note of those things and understanding that, okay, that she's told me that animal hasn't, been itself for a few days now, so let's look into that a little bit further. It's very subtle. Sometimes they're just not themselves, and that's really my most unfavorite phrase.
Yeah, it's pretty vague.
He's just not himself today. I'm like, okay, can you give me a little bit more? So
I just have a question here. So
subtleties, a lot of what I do is looking at, examining and observing. You can get a lot from looking at an animal, particularly birds, which you guys might already know. Is as soon as you put your hands on them, you change everything. So really standing back and looking and watching, are his lungs filling bilaterally, symmetrically, those kind of things. Is gut comfortable? Is he sitting comfortably in a normal position? So there's a lot you can take away from just observations. And before you put your hands on them. And the other thing I'll say is, because I graduated so long ago, we didn't have a lot of technology here when I started, and we still don't, probably to my detriment. So I'm very used to doing everything with my hands and my eyes. And I would encourage you to really let the animal tell you a lot before you start depending on technology, because I can tell you I've had normal blood results from a koala that's been dying and died in front of me. So you've got to be really careful to not take too much of the diagnostic toys without looking at the animal that's in front of you and really taking what that animal is telling you first.
It's great advice, Galit.
Thank you. Question? Was there a question?
Yeah, we do have a bunch of questions rolling in. So the first one here, so you mentioned you had to kind of remember what to do with sheets and everything. So what are some of, going off of that, what are some of the benefits and challenges of working with exotics versus small animals, production or equine?
I think because there's so much information about production animals and companion animals, and I really have to relate the species. So if I'm looking at a koala, I know it's a hindgut fermenter. So if there's a gut issue, I might often look at medications that are used in horses and try to extrapolate. A lot of my doses are just, you know, things that I'll try and work out and extrapolate from companion animals. The difficulty I find with production animals, so a kangaroo is a foregut fermenter, much like, you know, sheep and cattle. But the difficulty there is that sheep and cattle tend to be treated as a production extensive industry animal. So when you're dealing with individual, more like pets, let's say, getting information about how to treat and support an arthritic sheep is difficult, because sheep don't normally live long enough to get arthritis. So sometimes it's quite difficult to get that kind of information for our farm animals here, because they're all kind of treated like pets, let's be honest. And so I find that challenging to deal with them. And unfortunately, I didn't do mixed animal practice when I graduated. And I'll say that also, that if you have the opportunity and wildlife or exotics is what you want to work with, try to do mixed animal practice, because really dealing with those farm animals is really important if you then got to move into a zoo industry, and you know, there's a lot of hoof stock in zoos, and you know, there's ungulates and all of those things that you need to deal with. And if you've done the work before, you're a lot more confident in what you're doing, where I kind of missed out on that a little bit. I was lucky enough that I had horses myself, so that kind of benefited me. But yeah, a lot of extrapolation from companion and livestock into this, but really a lot of it's guesswork, and also having a good community amongst other zoo vets, so that you can call and email people and really talk about everyone's experiences and get other people's opinions on what you should do in certain situations. So if you are working on your own, like I am, that you're not feeling like you're working on your own, and that you have other people to ask questions of. And that includes production animal vets. So I still call people that I went to uni with, or vets that I interned under for advice if I've got an issue with a sheep that I don't know what to do with. So it benefits if you keep in contact with your classmates as well, because they're all doing all sorts of different things, and you can benefit from that.
So,
yeah.
Awesome.
And that answers the question.
That's a great answer.
Yeah, that is a great answer. And it kind of piggybacks on the next question here about, you know, advice for getting your foot in the door and working with wildlife in Australia. This particular person is a Canadian and moving to Victoria at the end of the year. So obviously, like you said, keeping in touch with people, a little bit of networking. Anything to add on to that for students looking to pursue working with wildlife?
Oh, I'd say volunteering, and really volunteering is and if you're good at it. So you need to listen, you need to be prepared to do the hard, awful work, you know, working in the rain, picking up poo, you know, you pretty much don't have contact with the actual animals, and you feel like you're really not getting a lot of experience. But you are, if you're really observing the animals that you're around, you're observing what they're getting fed and what's coming out the other end, which is really important. So don't, you know, diminish the importance of just doing the menial work as a volunteer, and really showing that you're a hard worker and that you listen and you're observant. That kind of, you know, we get vet students that come in that volunteer, and you can see their heart's not in it, and they're just wanting to do stuff with the animals. But really, you've got to show that you can do the crappy work first.
It's not just snuggles and cuddles and scratches. No.
And you know, just like they say to all vet students, you know, you shouldn't want to do vet because you love animals, because, you know, there's difficult, not very nice parts of it. But I mean, I really love animals, and I'm very grateful that I've had this as a career. But you have to be realistic about it. So I think starting as a volunteer, or if you graduate and you get the opportunity to do an internship, there are some internships in the zoos in Australia, but you really have to have a couple of years of clinical practice first, and some kind of background in doing something. So really you're forced to volunteer unless you can get a job in some way.